This is KOLO News Now. Good morning, Reno.
And is your toothbrush killing you? We sit down with an expert who answers that and more.
Welcome back, everyone. My guest today is Dr. James Mattingly. He is obviously a dentist. He's here for February because February is National Dental Health Month. Welcome.
Thanks for having me.
This is great to meet you. So listen, you have a pretty powerful message. Is your toothbrush killing you? Why could this be a reality? Tell us more.
Okay, so the biggest thing is the kind of brush you use and the brush technique you use. So in my experience...
You're a huge advocate of the electric toothbrush.
Huge advocate. There are 3 ways that I think your toothbrush could be killing you. The first 2 are really serious. The third one is kind of more embarrassing.
Okay, let's put the graphic up and we'll show you those 3 things. Okay, number 1.
Dental plaque. So medical studies are showing a link between plaque buildup on the gums of our teeth and plaque buildup on the coronary arteries of our heart.
We've known this a long time, right?
Actually, no. The studies are really starting to come together much more quickly now, showing this link. So if you are not brushing properly or use the wrong brush, have a lot of plaque buildup on the gums, it could actually contribute to heart disease and maybe even a heart attack.
I've heard that. I've heard every dentist I've ever talked to talks a lot about plaque buildup with the link to heart disease. Number 2, what's that? Tooth
decay. Okay, now everyone knows about cavities, but what most people don't know, if you get a cavity on any of your upper front teeth, and if that cavity grows and infects the nerve, it can actually lead to your brain a serious, deadly medical condition. We call it cavernous sinus thrombosis.
Okay, that's obviously a medical term for doctors. Okay, cavernous sinus thrombosis.
You got it.
That's right. Okay, number 3, bad breath. Some people, this can really deter them from jobs, having friendships, relationships. What's the deal?
Yeah, so this one, not medically going to cause death, but very embarrassing and socially could cause death. Bad breath. I call it the Clark Gable conundrum. You see,
Did he have bad breath?
He was an
iconic
Hollywood actor, but he had horrible breath.
I didn't know that. You learn something new every day. Well, he sure was handsome. We got to give him that. Okay, so let's go back to our toothbrushes.
Okay.
You're a big advocate of electric toothbrushes, not a manual. Tell me why there are so many more advantages with electric. I have electric. I would never go back to manual, but tell me why.
Okay, so the top brushes that are either electric or sonic, okay, we have one of each here. They tend to cost between $100 and $200.
Right.
But both of these brands have tips that can be exchangeable. So each family member can have its own tip, and you don't have to buy a new brush.
Right.
Right? So that saves a lot of money.
Okay, we're about out of time, but why do these remove plaque better than a manual?
Dentists get excited about this kind of stuff. Pulsations, oscillations, these brushes move at an amazing pace.
Sure.
And they guide you from one corner of your mouth to the next.
And they can tell you how long you've been here.
Exactly.
Right. Yeah, they're easy. You know, you can buy them even cheaper. I've seen them even cheaper, but it is a different feeling. Your mouth feels cleaner as well. Dr. James Mattingly, thank you so much for your time. 3 reasons why your toothbrush could be killing you, but an electric, much better for you. Stay with us. We'll be right back.